Come in.
Hi there.
Hello.
My name is Sansa and I'm going to be your nurse today.
Okay.
Can you start by telling me your name and date of birth, please?
Felix Hoff, February 14th, 1993.
Okay, perfect, Mr. Hopp. And do you have any allergies?
I do not.
Okay, perfect. So I'm going to go ahead and be doing a focus assessment of your head, ears, eyes, nose, throat, and your neck.
Okay.
Is that okay?
Yes.
Okay, perfect. So we're going to go ahead and begin. I got a couple questions I need to ask you, so just bear with me, all right?
All right.
I'm just going to go ahead and grab my notes here. So this first couple set of questions is just screaming for anxiety and depression. I want you to answer them honestly, okay?
Okay.
There's no judgment here. Your answers are not at all several days, more than half the days, and nearly every day, okay?
Okay.
So out of the past couple weeks, have you felt nervous, anxious, or on edge?
No.
Have you ever not been able to stop worrying or control your worrying?
No.
Are you worrying too much about different things?
No.
Have you had trouble relaxing?
No.
Have you been so restless it's hard to sit still?
No.
Are you becoming easily annoyed or irritable?
No.
Do you feel afraid as if something bad would happen?
No.
Do you have little interest or pleasure in doing things?
No.
Do you feel down, depressed, or hopeless?
No.
Trouble falling asleep or staying asleep, or just the opposite? Are you awake all night?
No.
Feel tired?
No.
You have a poor appetite, or the opposite, eating too much?
Mm-mm.
Feel bad about yourself?
No.
Do you have any trouble concentrating?
No.
Do you find yourself moving or speaking slowly, or just the opposite, moving
No.
or speaking too fast? Okay.
Mhm.
Any thoughts of harming yourself?
No.
Okay, perfect. So everything checks out great there.
Okay.
Got a couple more questions for you, okay? This is so I can gather a little bit of a history on you.
All right.
Do you have any unusually frequent or severe headaches?
No.
History of a head injury?
No.
Any dizziness?
No.
Neck pain?
No.
Lumps or swelling in your neck?
No.
History of any neck surgery?
No.
Difficulty seeing or blurry vision?
No.
Any eye pain?
No.
History of crossed eyes?
No.
Eye redness or swelling?
No.
Watery or excessive tearing in your eyes?
No.
Any eye injury or surgery
No.
history?
Mm-mm.
Have you ever been tested for glaucoma?
No.
Do you wear glasses or contacts?
No.
When was your last vision test?
Within the last year.
Okay, and do you have any earache or pain?
No.
History of ear infections?
Mm-mm.
Any discharge?
No.
Any history hearing loss?
No.
Any ringing, cracking, or buzzing in your ears?
No.
Any vertigo, like any dizziness?
No.
And how do you clean your ears?
Pretty thoroughly.
Okay, all right. So I'm gonna go ahead and get started now. I got a couple more questions. They're kind of silly that I need to ask you just to test for your level of consciousness. Okay.
Okay.
So you already told me your name, so that's a start right there.
Mm-hmm.
Can you tell me where you are?
Yes, in the office.
Okay, perfect. And what day is it today?
September 8th on a Sunday.
Okay, perfect. And who's the president?
Donald Trump.
Okay, perfect. So that's great. All correct answers. You definitely know where you are and whatnot. So I'm going to go ahead and get started. I'm going to go ahead and take a look at you first, okay?
Okay.
We're taking a look. I don't see any swelling like in the lymph nodes. Don't see the evidence of an enlarged thyroid or anything. Eyes are symmetrical. Looks like pupils are equal in shape. Ears, I'm going to go ahead and just tap on either side of you here. No excessive drainage. Ear canal is normal in color. Ears are normal in size and symmetrical as well. Perfect. All right, so I'm going to do a couple tests on your eyes first, okay?
Okay.
All right. So I'm going to just shine this pen light in your eye real quick, and I just want you to look right at me, okay?
All right.
Perfect. Perfect. Okay, so your pupils definitely reacted to the light. The lens is clear. You had a good corneal reflex, which is great.
All right.
I'm going to go ahead and do a couple other tests on your peripheral vision here.
Okay.
So I'm going to hold my fingers out, and when you see my fingers approaching, I just want you to say now when you see them. Look right at me, because this is testing your peripheral vision.
No.
Okay.
No.
Okay.
No. No.
Okay, perfect. Got some great peripheral vision there, Mr. Hopp. So definitely keep going to your eye doctor so we can stay on top of that, okay?
Okay.
All right. I'm also going to go ahead and pull out my Snellen chart so that we can test your actual vision.
Okay.
What I want you to do is when I'm holding this up, I want you to read the smallest line possible to me,
Okay.
covering one eye, okay? All right, so cover your right eye first. Go ahead, read the smallest line you can.
LTFPH.
Okay, perfect. And cover your other eye.
LTFPH.
Okay, perfect. Got some Great vision there, Mr. Hawk. 2020. I want you to go ahead and follow my fingers in a circle, okay? Perfect. So there's this thing called nystagmus where when your eyes move a little bit, or when you do that, your eyes actually like quiver a little bit there. And I didn't see any evidence of that, which is perfectly normal. And we actually tested a couple of your cranial nerves there, your optic nerve, ocular motor nerve, all help with the movement of your eye. So everything was everything looked great there.
That's good.
That's just an example of a couple that we're going to look at, or that we looked at, okay? So now that I'm done looking at your eyes, I just want to take a look at your throat here, or your mouth, okay? So go ahead, I'm going to shine my pen light in. Can you say ah? Perfect. Teeth look great. I'm going to just pull your lips down a little bit. Gums are pink. Perfect. Can you smile for me? Perfect. And then stick your tongue out and say ah. Uvula looks normal. Tonsils are not enlarged or inflamed. Throat is normal in color. Mucous membranes are pink and moist, which is all normal and great. Can you wiggle your tongue around for me? Perfect. All right, so that tested, you can go ahead and close your mouth now. That tested a couple more of our cranial nerves there. Actually, the hypoglossal nerve is what helps control the tongue movement.
All right.
So we tested a couple more there as we're going along, okay?
That's good.
All right, so we'll put that back. We'll put that back for right now. Okay, I'm going to go ahead now and do a couple tests with your hearing, okay?
Okay.
This is going to require some standing and some sitting and some standing and some sitting, all right? So just bear with me a little bit, okay?
Okay.
So first I'm going to do a couple tests with this tuning fork here, okay? And I just want you to tell me if you hear in both ears when I tap this tuning fork. You ready?
Yes.
Okay. I'm going to do one here. Here, sorry.
Yes. Yes.
Okay, perfect. And then at the mastoid process.
Yes. Yes.
Okay, perfect. And now if you could just stand for me and go ahead and face that way. I'm going to whisper 3 different words or 3 different random sounds, whatever. I just want you to repeat it back to me when I'm done, okay?
Okay.
7, B, 8. Okay.
7B8.
Okay, perfect. I'm going to stand on this side of you. 9, 9, 7. Okay.
997.
Okay, perfect. You can go ahead and sit back down. So that was what we call the whisper test. It tests, obviously, if we're experiencing any hearing loss. So I definitely want you to stay on top of that as well. Make sure we're not listening to our music too loud, exposing ourselves to really loud environments so then we can reduce the risk of hearing loss over time, okay?
Okay.
All right, perfect. So now I'm going to go ahead and test your balance. So we're going to get up one more time, okay?
All right.
If you can just get up for me, and I just want you to walk around in like a little bit of a circle, just back and forth for me. Okay. And you can go ahead and sit back down. So that was a good, nice, even gait. I didn't see you stuttering or anything like that. So that's perfect, great balance. And we're gonna stand up one more time and step away from your seat a little bit and then just close your eyes, okay? Put your hands out to your side. Perfect, you can go ahead and sit down. So that's called the Romberg test, and it just tests for your balance. Sometimes when people close their eyes, they kind of lose like their sense of perception and they start to like falter a little bit. So that was great because none of that happened with you.
All right.
Okay, perfect. So I'm going to go ahead and I'm going to test for a couple more cranial nerves. There's one called the spinal accessory nerve. Can you go ahead and shrug your shoulders for me? That was an even shrug. Perfect. And then I'm going to go ahead. Can you turn this way? Perfect. And turn this way. Perfect. And actually we tested for a couple other of those nerves when we were doing those other tests.
Okay.
There's one that we tested called the vestibular cochlear with your balance, and that also helped with the hearing and stuff too.
Okay.
So we tested a couple more cranial nerves there. I'm going to go ahead now and we're going to do, now that we got all that fun stuff out of the way. I'm just going to palpate for your lymph nodes, your thyroid, and stuff like that, okay?
All right.
So we got preauricular lymph nodes here, not swollen or enlarged. Postauricular, occipital, submental, submandibular, superficial cervical, deep cervical, and supraclavicular lymph nodes. Perfect. And then I'm going to go ahead and palpate your thyroid. Perfect. Equal. Great in shape. It's not enlarged. All right. So now I'm going to do a couple of other tests for sensory purposes, okay?
Okay.
I'm going to hand you, go ahead and close your eyes, and I'm going to hand you a familiar object, okay?
Okay.
And I just want you to feel around in your hand. You're going to tell me what it is, okay?
Feels like a key.
Okay, perfect. I'm going to do another test here. And I'm going to write on your hand. I want you to tell me what I write.
Okay. 6.
Okay, perfect. Great job. And then I want you to tell me if I'm moving your finger up or down.
Down. Up.
Okay, perfect. And on your other hand?
Down. Up. Up. Down.
Perfect. And then I'm going to go ahead and test for response to pain. Tell me if this is dull or sharp.
Sharp. Dull. Sharp. Sharp.
Okay, perfect. And then just tell me, I'm going to do a light touch now, and you're going to tell me when you can feel it.
No. No.
Okay.
No. No.
Okay. Perfect. You can go ahead and open your eyes. Okay. And then I'm just going to test one more cranial nerve. It's called olfactory,
Okay.
which is smelling. So I want you to close your eyes and plug one of your nostrils. And then what do you smell?
Smells like lemon.
Okay, go ahead and do the other one.
Smells like lemon.
Okay, perfect. So nose is intact. Everything's working there.
All right.
All right. And then we got to test for a couple reflexes here, okay?
Okay.
I'm just gathering my supplies, okay?
Okay.
It's in my pocket the whole time. Wow.
Mm-hmm.
All right, so I'm going to go ahead and I'm going to test first your, just relax your arm. You see that little quiver that just happened when I struck my thumb? It's called a bicep. That's your bicep. What's it called? Fruit reflex.
Okay.
Okay. So I'm going to go ahead and I want you to just relax your arm again. You can let it hang loose like you're dead weight. You see how your arm did like a little quiver there?
Mm-hmm.
Tested for your tricep.
Okay.
So we'll do the same on this arm. Just relax. Okay. Same thing. Okay. And then we're going to go ahead and we're going to do your leg. Not just bend down here. If you can scoot back so your feet aren't on the floor completely, like scoot yourself back. Yeah, and then we can see it better. And that little quiver,
I see it.
a little quiver. And then I'm going to go ahead and lift your foot up. This is called Babinski's test right here. See how your toes curled forward? That's a normal response for people your age.
Oh, okay.
So I'm actually going to tell you a little fun fact here once I finish with that. So actually, a fun fact to do with that is as infants, when we do that reflex, infants' toes flare out.
Oh.
like that. Like
Okay.
how your toes curled,
Mm-hmm.
they instead flare.
Okay.
So when we do that on adults, after the age of, I believe it's 2, children should start being able, their toes should start curling rather than flaring.
Okay.
However, in adults who might have a brain injury or something like that, their toes might flare.
Oh.
So that's one of the reflexes that we can tell if there's something going on in the brain.
Okay.
So I think that covers everything
All right.
as far as your assessment goes, and everything looked normal to me.
That's good.
And like I said, just keep checking up with your eye doctor.
Mm-hmm.
Definitely stay on top of your eating correctly, exercising daily,
Okay.
that kind of thing, because I know that we just assessed your ears, eyes, nose, and throat today,
Mm-hmm.
but it all plays a part. Everything ties in together, okay?
Okay.
So did you have any questions for me?
No, I don't think so.
Okay. I'm going to go ahead and head out then, all right? If
All
you
right.
need anything, please don't hesitate to call, okay?
Okay.
All right. Thank you very much.
You're welcome.